Now to the coronavirus outbreak. The CDC is preparing for a potential pandemic and says it's inevitable the virus will continue to spread in the U.S. And one Bay Area city isn't taking any chances, declaring a state of emergency. Today, KPIX5's Kiet Do is live at Stanford to explain. Kit?
Yeah, so the announcement by the CDC put local governments and organizations on notice, saying that it is inevitable that this disease will spread in the U.S.
New infection hubs have now established themselves in South Korea, Italy, and Iran as the coronavirus moves closer to worldwide pandemic status. Dr. Nancy Messonnier, head of the National Center for Immunization and Respiratory Diseases, told lawmakers this might be bad.
Ultimately, we expect we will see community spread in this country. It's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will have severe illness.
Health officials are now learning that the incubation period looks to be about a month long, with the virus able to survive on wet surfaces longer than previously thought, and people who have had no symptoms are able to transmit the disease. Federal health officials are warning local governments and organizations to have a plan in case of an outbreak. San Francisco Mayor London Breed declared a local emergency today, despite no confirmed cases in the city.
And by declaring a state of emergency, we are prioritizing the safety of our communities by being prepared.
So I'm confident in our team's ability to handle the situation.
At San Jose Unified School District, the largest in the South Bay, they're applying lessons learned from the H1N1 outbreak of 2009, where some Bay Area schools were shut down for days and disinfected. Melinda Landau, manager of Health and Family Support Programs, says there is a healthcare worker on every campus, monitoring kids' sick calls and looking for patterns. And cleaning crews now use disinfectant fog machines similar to these to sterilize classrooms.
What happens is we look and like if we have a couple cases in a classroom, we'll send out extra cleaning crews.
Dr. Iran Ben David at Stanford University says everything he's seen suggests the virus will spread here in the U.S.
It would not be at all a surprise if all of a sudden there was a cluster of cases in the United States.
The big question is, how much will it spread? Computer models vary widely, but Ben David said today's announcement and warning was sensible.
I have a lot of faith in the public health system and its ability to contain things. But at this point in the United States, there's no need to panic.
Not yet?
Not yet.
And the county released a statement saying the health measures taken by the County of Santa Clara Public Health Department have helped to limit the spread of the disease in Santa Clara County. These measures have brought us more time to prepare for the possibility of widespread transmission of the disease. And of course, they're talking about keeping up their communication plans with the schools and the community, and also working with the schools for a so-called telelearning program or online classes should they have to shut down a school in the event of a coronavirus outbreak here in the South Bay. We're live at Stanford. Kiet Do, KPIX5.
In the last hour, we've learned 3 coronavirus patients from Travis Air Force Base are being treated in Contra Costa County, and 1 is at a hospital in Sonoma County. All of these patients were evacuated from the Diamond Princess cruise ship in Japan.